Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often the steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing and includes creating a usability testing plan and then conducting usability testing, analyzing results, and making adjustments covered in modules 2 and 3 in this series. Part 2 is piloting and includes determining the approach and developing a plan, identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and then making adjustments covered in modules 4 through 7 in the series. And Part 3 is staging and scaling up, including this module on developing and refining plans for staging the intervention and scaling up, then identifying sites and sequencing, building capacity and scaling up, and reviewing progress and benchmarks. In this module, we will take what's been learned from the previous testing experiences, usability and/or pilot testing, and develop plans to stage and scale up the intervention for implementation on a larger scale in a sustainable way. Let's get started. Teams should use lessons learned from the pilot experience or other testing to develop plans for staging an intervention and scaling up. Developing a plan for staging and scaling up the intervention allows teams to prepare for implementing the intervention on a wider scale in a sustainable way, to identify the tasks and activities that will be necessary before, during, and after implementation and their sequencing, to identify capacity and readiness for staging and scaling up, and the supports and available or needed resources to implement at each progressive site, and to decide how to use data to inform improvements. Teams may take different paths for rolling out and scaling up an intervention, including staging, which could be incrementally introducing the intervention, either by geographic area, for example, by regions, counties, or clusters, or by phase of the intervention, for example, by core components or aspects of the intervention. Or the team may choose a statewide launch of a full intervention in all locations at once. Factors that the team may consider when they decide the appropriate path include the intervention scope and complexity, the team's existing implementation plan and information about agency readiness for the implementation effort, related mandates and timeframes, the intervention's implementation history and evidence base, the availability of developers to support implementation, and available capacity, including the workforce's ability to take on new practices and capacity to train additional sites using earlier sites. Generally, teams should consider staging to effectively manage implementation and allow for gradual adjustments. As with usability testing and piloting, teams should develop a flexible plan to guide the process and integrate it into the overall implementation plan. Expanding an intervention beyond usability or pilot testing in a sustainable way requires that teams make strategic choices in these key areas. Site selection and sequencing. How many sites are expected to adopt the intervention? Which ones should begin implementing first? What is the process for expansion? Over what time period? Organizational processes. What implementation supports, such as protocols, training, and coaching, are needed to support staging and sustain sites over time? Will experts or new partners provide assistance? Capacity. Are resources and capacity for expansion available? Are local implementation teams in place to support implementation? How will knowledge and skills be developed? Are there achievable economies in scaling up? And monitoring and evaluation. How will fidelity, processes, and outcomes be monitored and evaluated? Additional information on monitoring and evaluation is presented in the Change in Implementation in Practice series on monitoring, evaluating, and applying findings. As teams move beyond a pilot environment, they often have to balance their vision of expected outcomes with practical realities and constraints. Plans must take into account both external factors, for example, legislation, policies, funding availability, networks and relationships, and internal factors. For example, readiness for change, agency culture, and staff attitudes towards the intervention that may influence implementation. In addition, teams should recognize that each new site will experience the intervention as new, even if it has been piloted, and they should consider site readiness factors, particularly as they relate to motivation. Do staff view the new program as addressing a pressing need? Are new practices seen as better than the existing approach? Are they easy to understand and apply? And does the program align with agency values? Are the outcomes visible? Representatives from the pilot sites can help to promote motivation in new sites by sharing experiences and success stories. For more information on readiness, motivation, and related factors, please see the Change in Implementation in Practice series on readiness. Let's review some lessons learned from the field with staged implementation of an intervention in child welfare Title IV waiver demonstration sites. Develop a strong infrastructure to support scaling up, involving staff at all levels and community partners. Promote consistent leadership and management commitment. Be very specific and detailed in presenting the overall vision and the plan for scaling up. Develop relationships with local site leadership and enable their voices in rollout and staging. Think about sustaining capacity over time and being equitable with resources for all sites beyond the pilot sites. Promote cross-site sharing of information, experiences, and success stories. And use a strong CQI process to address barriers and incorporate evaluation findings into ongoing improvements. What helps teams to develop or refine plans for staging the intervention and scaling up? As a team, consider the following questions. Have lessons learned from testing or piloting been integrated into the plan? Will the implementation be staged? If so, how? What factors does the team need to consider? For example, is the intervention relatively simple, or is it large and complex? Are there tight timeframes, or is it a new intervention? What tasks or activities are needed at each site before, during, and after implementation? Do the plans support scaling up in a timely manner? What implementation supports are needed to support staging and sustain sites over time? Answering these questions as a team will help to develop and refine comprehensive plans for staging and scaling up the intervention in a way that is feasible for the agency and addresses any related mandates or timeframes. Let's take a moment to check in on what you've learned about developing and refining plans for staging and scaling up. Why do teams develop or refine plans for staging the intervention and scaling up? To identify tasks and activities for before, during, and after implementation, any capacity or readiness needs and resources, and determine how they will monitor and evaluate the implementation effort. How do teams develop or refine plans for staging the intervention and scaling up? Considering the approach as a team, making critical decisions on site sequencing, processes, capacity, and monitoring, and then considering site factors that might affect implementation. What can help teams develop or refine plans for staging the intervention and scaling up? Considering lessons learned from the field and any testing results, reviewing what factors may influence the approach, and the tasks or activities needed at each site before, during, and after. Now, take this a step further by reviewing the reflection questions for develop or refine plans for staging the intervention and scaling up in your intervention testing, piloting, and staging workbook to connect what you've learned to your own experience. Up next is identify sites and sequencing, the second essential function for staging and scaling up, and the 9th module in this series.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.